Okay, so I would now like to introduce our first speaker, Jennifer Jones. Jennifer Jones is a board-certified clinical specialist in pediatric physical therapy who works at the Children's Hospital of Philadelphia. She treats both as an outpatient physical therapist and a physical therapist in the Neuromuscular program. Previously, she has volunteered as a camp counselor during MDA summer camp for 5 years. So thank you so much for joining us today, Jennifer, and I will go ahead and hand it off to you.
Great. Hi, everyone. Thank you so much for having me. Just bear with me as I bring up my slides for you. There we go. Okay, so I am very excited to talk to you guys a little bit about exercise today. So just a brief overview of the presentation. We're first going to go ahead, before getting into some tips and some different interventions, I'm going to go ahead and discuss the benefits of exercises in many age groups, talk about how this is specifically relevant to individuals with neuromuscular disease. I'm going to talk about something called the FIT principle, and then also discuss the different components of it. And then from there, talk about a couple different exercise interventions for individuals with neuromuscular disease. So I do have a little disclaimer. This presentation is for educational purposes and shouldn't replace any advice that's been provided by your medical team. It's just important to know that every different neuromuscular disease may respond just a little bit differently. So just as you're developing a new exercise program, it's also important to discuss the benefits and risks with your medical team. So what is exercise? I know this sounds like a simple question, but it is a little bit different of something that we would consider physical activity. So physical activity is something that's done from a day-to-day basis. So this is something that just more of your general bodily movement, where exercise is actually going to be more of a planned, structured, and repetitive motion. And I want to talk a little bit, so first I want to introduce what the ACSM is. So this is an American College of Sports Medicine, and this is actually our gold standard when we are providing exercise recommendations. So as you can see up on the screen, there's many benefits from a pretty wide range of ages. So anywhere from 3 to 50, as you can see on the screen, anywhere from cardiorespiratory, muscular fitness, body composition, and even looking at preventing hypertension, type 2 diabetes. And really it seems that the key here is shooting for about 150 minutes per week. And while I know that sounds like a big number, this can be broken down into about 20 minutes per day. So let's look a little bit more specifically at why exercise is important with neuromuscular disease. So first, we want to maximize our function. The principle use it or lose it does come in play here, because if we're not using our muscles, the idea is that we potentially can get weaker quickly or develop contractures quicker. So we do want to, with exercise, minimize contractures and then also decrease weight gain. Both contractures and weight gain can actually are actually linked with function as well, which is why we want to maximize your function. The other reason it's important is we want to help maintain bone strength. We know that steroids are very common with many individuals with neuromuscular disease, and that can also be linked with osteopenia, where your muscles or your bones get a little bit weaker. So by doing exercise, this is actually something that can help combat that. Now, there are some things that we want to be a little bit cautious with when developing exercise. So thinking about eccentric strengthening and then also the type of intensity. And I'll go ahead and define those a little bit more in the presentation for you guys. So the FIT principle, this is something that's going to help you create like a workout plan. You're going to look at your frequency, your intensity, your time, and then also the type of exercise that you're doing. I'm going to start a little bit backwards here, so I'm actually starting with type. So we're going to look at strengthening, where you can be strengthening both your muscles and your bones, aerobic, where you're getting your heart rate up, and then flexibility, where you're stretching your muscles. So with strengthening, there's a couple different types. I'm going to define those a little bit more on our next slide. But then there's also a couple different techniques that you can use. So you can actually eliminate gravity and do strengthening without gravity. You can move against gravity, and then you can also use a little bit of resistance, which is typically done with some sort of weight or resistive bands. So when looking at the different types of strengthening, I'm actually going to use, I love cookies, so I'm going to use my cookie example. So isometric is if you put your palm up to the ceiling and you place a jar of cookies right on your palm. So we don't want that cookie jar to fall off or move off of your hand, so your joint is not moving. So this is what we would call an isometric muscle contraction. Concentric is when you're starting to move that cookie up to your mouth. So that's where your muscle is actually shortening. Eccentric, as I kind of talked a little bit about before, is where you're taking that cookie away from your mouth, and that's going to be where that muscle actually lengthens. So using our traffic light analogy, so green where you're good to go, typically neuromuscular diseases that involve more than nerves, like Charcot-Marie-Tooth, is okay to start an eccentric muscle strengthening program. Where we want to be a little bit more cautious is where those diagnoses that involve more than muscle membrane. So an example would be more of Duchenne muscular dystrophy. So there's many types of ways to do strengthening. Aquatics is a great way to do this. There's many benefits. So you can use the buoyancy of the water. So that's going to help minimize the effect of gravity. You can also use resistance and kind of tailor the resistance to you by using the drag of the water. So the quicker that you're moving your arm or your leg through the water can make a difference in terms of how hard it is. It's also great because you can use multiple different functional levels, can get in the pool and get benefit out of it. So you can see on the left side of the screen is for someone that is able to stand. There's a couple different ways that you can move your legs around just to be able to start strengthening those leg muscles. You can also use a flotation device, or great in the pool, because it's going to give you a little bit more independence and be able to move easier in the pool without having help. I have like 2 different types of neck rings listed up on the screen, which are also great ways to move in the water. You can also do strengthening through slings and springs. So what slings and springs is that's really where your limb is suspended and then it's taking away the impact of gravity. So you're not really having that friction to worry about anymore. You can do this again. You can do this with multiple functional levels. In the picture, I have a PVC device set up, but you really can use anything where you can suspend bands and a cuff, where it has to be sturdy enough to support your limb. So in the pictures, I do have your legs, but it's also really great for arms as well. Aerobic. So this is where we're getting our heart rate up. So the ACSM definition is where we're using larger muscle groups, and then it's something that can be contained continuously and is more rhythmic. So it's very repetitive and that you're doing for a duration of time. 2 types of aerobic exercises that can be completed and that's safe in the neuromuscular population is in the water, and then also cycling. So I have a picture of an adapted bike up on the screen, which is really great because it can give you a little extra support if you want to be able to go outside. But then I also have an ergometer where you can place it on like a tabletop or even on the floor. So you'd be able to sit in your chair or your wheelchair and be able to use this. Flexibility. So this is looking at a different couple ways. So passive range of motion is where you're having someone else move your limb through your available range of motion. Active range of motion, that's where you're moving your own body through its available range of motion. Active assisted range of motion is where you can help yourself move your limb through like the range of motion available. And then we have stretching. So stretching is important because contractures are very common in neuromuscular disease or diagnoses. So what you can do is go ahead and place your stretching is where you're actually placing your muscle in a lengthened position. And this can be done through static stretching where you're counting to about 20 or 30 seconds. And so this can be done by somebody else, or this can be done by yourself as well. There's also, you can get stretching through a principle called low load and prolonged stretching. And this is typically done through serial casting or night splints. And the other way that you're able to get full available range of motion is also by doing any type of standing or supported standing through like a stander. Okay, so frequency is the next part of our FIT principle. So looking at that's how frequently you're doing your exercises. So while we're looking at frequency, it is important that you do have rest days in your program. This is really going to allow you to be able to monitor and see your tolerance to your current program. So this is where you're going to know if you went a little bit too hard or if you need to push yourself a little bit more. Strengthening is recommended for about twice a week, bone strengthening at least twice a week, and then aerobic is 5 days a week. And this can be done cumulatively, but it also can, especially as you're first starting off, it can be split into like smaller sections throughout the day. Intensity. So how hard should I be working? Submaximal is what's recommended for the neuromuscular population. So this should be about light or moderate. So how do we know how hard we're working? There's a couple different ways that you can use to measure and see how hard you're working. The first way is rating of perceived effort, or RPE, where 0 is you're sitting and watching TV and really not doing too much. 10 is where you're working as hard as you can and you just can't possibly go any further. Talk test. So that's just looking at your ability to talk while you're doing exercise. And then you can even look more specifically at your heart rate by using a formula of 220 minus age. So I put together just like a little chart just to kind of help you figure out the difference between moderate and vigorous. An RPE of 3 to 4 is typically recommended as moderate. 5 to 7 is vigorous. Oh, and excuse me, I just have a little something in my throat. Talk test is where you can keep a steady conversation, and then at moderate, and then vigorous is where you're unable to speak more than a few words. Looking at your heart rate, you can use your formula by using like your watch or your chest strap, and then that's typically 64 to 76 is considered moderate, and 77 to 93 is vigorous. So how long and how much? Strengthening, we want to shoot for about 8 to 12 reps. For flexibility, we want to stay in the range of 20 to 30 seconds, but for that low load prolonged stretch, it's going to be a bit longer at about 6 hours. Aerobic, we're really shooting for about 150 minutes per week. And there are a couple of articles that for cycling are recommended about 30 minutes, 5 days a week. And that was including your warm up and cool down. So in conclusion, exercise has been shown to be safe, and it does appear that it is showing great benefits. It does need to be specific. So the program should be specific to your diagnosis and then also your functional level. We do want to incorporate it into your daily life and then also to make it fun. And the reason is this is something, in order to see some good results, it is something that needs to be done on a regular basis. And then in general, unfortunately, we really do need more research for more specific guidelines. So it's all the protocols and literature are very variable, including the intensity and duration that is listed. And then just to mile my references. And that's all I have for you guys. Thank you so much for listening to me.
Thank you so much, Jennifer, for that presentation. I'm going to open it up to a quick Q&A before I introduce our next speaker on this topic, Kim Anderson. So if there are any questions in the chat, I'll just leave a minute or two here to see if there's any questions coming in. And then if not, I'll go right into the next part of the presentation.
I think I went too vigorous on my presentation. I have something in my throat.
Awesome. Well, I don't see any questions in the chat, but again, for any audience members, if you do have a question that comes up after this presentation, you can email mdaengage@mdausa.org, and this will be recorded and put on our website. So again, thank you so much, Jennifer, for your presentation. We really appreciate all you do for the neuromuscular community.
Thank you, everyone. I appreciate it.
Awesome. All right, and now I'm going to introduce our next speaker. So our next speaker is going to be Kim Anderson. Kim Anderson has been an occupational therapist at the Children's Hospital of Philadelphia since 2012 and a pediatric therapist since 2008. She provides outpatient-based therapy services, interdisciplinary specialty clinic consultations and evaluations, and participates in clinical research. Her specialty practice includes the use of splinting and dynamic movement orthosis for patients with neuromuscular diagnoses. Kim specializes in aquatic therapy for children with a variety of medical diagnoses, including neuromuscular diagnosis, brachial plexus injuries, and hemiplegia. She leads an aquatic therapy group for caregivers and patients with spinal muscular atrophy. Thank you so much for being with us today, Kim. And I'm going to go ahead and give it off to you.
Okay, great. Thanks, Kristen. I'm sorry, I'm not able to get the video to work on the screen here. Can you hear me?
Yes, we can hear you.
Okay, great. Let me get the share screen here. All right, are you able to see my presentation?
Not currently.
Okay, sorry about that.
Here.
Oops. Try again. Okay, I think it says I'm sharing my screen. I'm not sure.
We aren't able to see it up on the screen right now, but we can definitely try to pull up our secondary slides for you if that works.
I'm sorry, Kristen, can you see it now, or I will need you to present the PowerPoint?
We're not able to see it right now, but I will go ahead and find the PowerPoint and share my own screen.
I'm sorry, thank you.
Kim, are you able to see the screen shared right now?
Yes, I can.
Perfect. Is this gonna work for you?
Yeah, if it does for you, I apologize. I don't know why my thing isn't working.
Great, no worries at all.
Okay, well, first of all, thank you for the NDA for putting on such a great event. My name is Kim Anderson, and I'm going to talk to you today about everyday tips for activities of daily living. I have no financial disclosures. And the objectives of this presentation today are, I'm going to review with you the advances in adaptive clothing options. We'll talk a little bit about adaptations to assist with completion of ADLs, and then just reviewing some technology within the home that can help with independence. So first, I wanted to give my own profession a little plug here. With all the options that are available these days, it's great that there are so many, but a lot can be overwhelming and can also become expensive, especially if you're not sure what you need. So as an occupational therapist, we are able to help you identify your own strengths and needs. We help you identify and prioritize which specific ADL goals you have, and then help you to identify what adaptations will work best for you for your own specific individual needs. So this next slide, when I first started doing this presentation, probably like five or 6 years ago, we maybe had 2 or 3 things to put on the page. And these are just a few of what's available now. I wasn't even able to fit everything on here. And you can see there's a lot of familiar mainstream clothing companies that are now providing adaptive clothing. So first, one of the main things that a lot of these companies are providing are magnetic and Velcro closures instead of having the button and zippers and snaps. This is perfect for our patients who have distal motor function issues, fine motor delays or weaknesses, or if they have distal contractures. You can see our friend here on the left, he has a Velcro opening on the left leg that can help if you were to need a brace on that side. And then the right side has a shorter pant leg to be able to easily access his device that he needs for the right. The next picture to the right, you can see the Tommy Hilfiger jeans are taking away the zipper and those hard to button buttons altogether. And as soon as you match up the clothing, the magnets will come together and the Velcro comes together, but it still looks like there's a button and zipper from the front. So it looks still like mainstream clothing. For the top right here, a lot of our teenage girls are experiencing difficulties with being able to latch their bra both in the back or in the front and being able to turn it around. So a few of those companies on that slide that we just showed are providing now sports bras and regular bras that have both magnetic and Velcro closures for ease of use. And then this bottom right is actually a company that I found on Etsy. So for our patients that maybe have some lower extremity weakness, these dress pants still have the appearance of being dress pants on the front, and they are dress pants, but they actually zip or Velcro or have magnetic closures on the side. So maybe like while you're getting dressed with sitting down or laying down, you can put them on that way and then zip them up on the side rather than having to lace your legs through the bottom. Next slide. This company here does, on the right, sorry, using strategically placed loops to help some of our friends that have maybe those similar situations of distal weakness or finger contractures, wrist contractures. So you're able to position your hands through the loops so that can help you with pulling the clothing items up or down rather than relying on that pinch that's typically used. And they make clothing from toddler all the way up to adult. So it's been great for a wide variety of our patients. And then one of the types of clothing that is sometimes missed is compression. There are some patients, like with hypotonia or hypermobility that have some lack of body awareness and attention issues. So sometimes we will recommend compression clothing, and up until more recently, we would have to recommend like an Under Armour or like a swim type shirt clothing or pants. Whereas now there's more companies delving into compression, so the items can look more mainstream, as you can see in this picture here to the right. Next slide, please. Okay, so shoes now are, there's more and more companies that are providing the zip option for a wider opening. You can see here the Billy Footwear and Nike are both diving into this realm. So patients who have devices that they may need to wear on both feet or one foot are able to use these shoes for ease of getting them on and off. And I can tell you the two companies that I know, Nordstrom and Zappos, both offer the option of if you are wearing a brace only on one side, you can have the option of buying a single pair of shoes that are two different sizes in case you need to size up on one side. The top right Nike sneaker here doesn't have any type of tie closure at all. All you need to do is position your toe and slip your foot in, and the shoe closes. And all you need is a little pressure on the back heel with lifting up of the foot to take your foot out of the shoe. In the bottom right here, the Hickeys is just one company that we typically will recommend. You can pre-lace these into your typically tied shoes and turn your tie shoe into a slip-on. So if you're a person who has a particular shoe that you like the Brooks or Nike or any kind of tie shoes, Hickeys is a great company because they have lots of different colors and designs that you can use to turn your shoe into a slip-on. I don't really recommend this for anyone who has a brace because it will make it harder to put on, but anyone who's just having difficulty with the tie and wants a slip-on, those are great options. This slide here, I figured, you know, since we're next week coming into the Halloween holiday, it was great seeing more websites that provided Halloween costume options with similar adaptive clothing styles and even adapted to the wheelchair. So Kohl's, Target, and Disney were the main ones that I found, and for pretty cheap prices. So it's just great to see such a widespread here. Next slide. So a couple other clothing fasteners. You can see the belt at the top here. Latching a belt can be extremely difficult for someone who has a sensory neuropathy or distal contractures or just a fine motor weakness. And here we are using the Velcro technology to still have the appearance of the latch belt, especially for like work or dress uniform clothes. On the bottom, the mag zip, a lot of our patients love this. You can buy just the zipper itself, and if you're a sewer, you can adapt it to the clothing that you already have. If you're like me and you're not, Under Armour has a line of these sweatshirts, and Etsy also has a few shops that provide clothing options with this magnetic technology. The two sides just line up and latch together using magnets, so you don't have to worry about the latch. And then you can just pull the zipper right up. Next slide, please. So for feeding and grooming, this cup with the straw is pretty familiar. It's a flexi straw that's long, so a caregiver can set up the cup into a position for someone who has lack of upper body movement so that they're able to access the straw themselves with independence. The vibrating toothbrush is a good option for our patients that don't have the strength to really use the force to brush their teeth. So the vibration helps with that. The plate guide helps with getting the food onto the utensils for those that have trouble spearing their food or scooping. And this picture to the right is a company called Easy Hold. You can see they sell, it's a silicone universal cuff that you can put on, as you can see, a hairbrush, utensils, pencil, really anything that you can use a universal cuff with. Okay, next slide, please. So for this, I just thought I would show this fun snack cup here. A lot of mainstream typical snack cups for kiddos have the harder plastic with the slots where the kids have to push their hand through really and have a good grasp to then bring the food back out through that resistance. And this cup here, you can see, if you could play the video, sorry. I wonder if it's gonna work.
I don't think the video is able to play.
Okay. So if you were to see the video, the cup can be turned in multiple different directions without spilling and still have the open surface for the patient to access. So if you have to hold it in a certain position due to contractures or weakness, then the bowl is still open to retrieve the snack from with ease without having that hard plastic to work through. Okay. And next we have something that's called the Liftware Level. I apologize, the video probably won't work, but this gentleman does a great job of demonstrating how the spoon is able to stay level no matter what direction he's holding it in. So I'll describe, like, this patient, or this gentleman, sorry, is going to scoop his breakfast, and he's really testing it out, twirling the spoon all around in different directions with the yogurt on there. And never spills it. And you can see it also still has a universal cuff option. So if you have that lack of grasp, or you don't really have the supination to achieve bringing the spoon to your mouth, the spoon is able to kind of adjust to what you need. And it's battery powered, so it adjusts as you need it. Go ahead to the next slide. Okay, this device is called the Obi device. I apologize, there's a video here. What it does is it uses a switch system, 2 switches. You can set the spoon up when you start the meal to meet your mouth to where you're sitting. And then 1 switch you click to pick at 1 out of the 4 bowls to eat from. and then the other switch will bring the food to your mouth. It doesn't necessarily have to be like a typical switch that you can think of, like the button switches, and it can also be hooked up to your phone for voice activation. You can see the picture on the left. The little boy is just mainstream sitting in with his classmates, not having to be fed by an adult. And it's been a huge game changer for some of our little ones in just building independence in a social setting too. Okay, next for meal prep. A lot of our little ones don't do a lot of meal prep, but for if they were to get a bowl of cereal or a drink from the refrigerator, we will recommend getting the Magic Tap. So you won't have to lift the large gallon of milk out of the refrigerator. We're thinking about the rest of the family. A lot of our families were going out and buying smaller things of milk so that our patients could access it. And here, all you have to do is put the cup or bowl up to this lever here, and the milk or whatever liquid you have in that container can easily come out. The bottom left here, someone combined the technology of using the pizza cutter and the rocker knife. And you can use the same cutting strategy with less gross grasp, and it does put a lot of its own pressure on there, so for more independence in that way. Next slide. So for showering, typically, depending on your needs, we will recommend a handheld shower head. Pump top and automatic soap dispensers can also make things easier. Using a shower mitt, so just slipping a shower mitt over your hand if you're having difficulty holding on to a washcloth. And then handles can not only be helpful for safety with getting in and out, but we will sometimes recommend for our patients who have a hard time achieving their hands to their head and sustaining it for long enough to get the soap out. You can put a handle horizontal to prop your elbows on to sustain that position for long enough for hair washing. Next, please. So in the OT world, we're not only adapting the activity for the patient, but we can also adapt the patient to the activity. So for some of our patients who are a little bit weaker in their upper body, we will use a mobile arm support that uses suspension to help the patient increase their active range. It helps with positioning depending on the task. It reduces the amount of unsafe posturing, so that leaning forward or moving their trunk around in order to achieve a hand to the mouth for self-feeding, for instance, or brushing teeth. And the next slide here are a couple of videos. I apologize, I'll send the slide back out to the MDA so that they can have the videos too. The left video was one of our friends. He's got good elbow flexion extension, but doesn't have much movement at the shoulder, and he does a lot of dance moves with his trunk and his head to try to achieve his hand to his mouth. And then the picture or the video on the right is him in the arm support device. And he's got a lot more dance moves with his arm. He's able to easily achieve his hand to his mouth for brushing teeth, washing his face. Some people use it for glasses adjustment, things like that, that some of us take for granted, you know, like not having to ask anyone to do that for us. This device can also be used, as Jen was describing before, with exercise for our patients who are also working on strengthening. Once they're positioned in this device, they can do those movements to help with active movement for video games and other things like that. Okay, next slide. Adaptive technology. As you can see, technology is not my strong point here, as I cannot get my video working or my slideshow. But we do have a great group of OTs here that we send our neuromuscular population to, and they can do a specific assistive technology evaluation. But a lot of our patients do report that they love this Microsoft Xbox Switch system, where they can play the same games that their friends do using the adaptive switches. Next slide. Smart home technology. I won't say the name out loud because if you're watching, it'll probably set the devices off. But the Amazon and Google seem to be the most popular, where you can use your voice activation and it can really access a lot of things within the home. So door locks, opening and closing doors, ceiling fans, opening and closing blinds, the thermostat, the TV. A lot of different things can all be accessed with your voice or with switch technology. Let me go to the next slide here. And this is just an example of one of the switches that we were able to use. So this is the example. We used the same switch technology with a teenage patient who had SMA and a little bit of thumb flexion. We hooked it up to a speech device where with the clicks, he was able to spell out words to say to his Alexa. And I think he was 19 or 20. And at that age, his family learned that he liked a certain type of cartoon show and he loved country music, and they never knew that about him because now he was able to speak through this switch technology, and not even to tell his parents what to do, but the Alexa was able to access that for him. And this is just a quick review on how you can make your own switch. I do have directions if you're looking for that too. You can make switch things at home. You can adapt toys, or like we talked about, the switch technology for talking to the Alexa to access the home environment or video games. And then the last slide here. We're very lucky in the state of Pennsylvania that we get to work closely with TechOwl. It's a company that's supported by the state, and TechOwl is able to provide assistive technology for anyone within the state of Pennsylvania for whatever your needs may be, anywhere from building a PVC pipe chair to access a beach to developing 3D technology for a key holder or other things like that. And I did have a video here. They are on TikTok. I don't know if some of our viewers here use TikTok, but if you look up TechOwl, they have some great technology suggestions, and I'm sure they would be willing to help you with any of your needs, even if you are not in the state of Pennsylvania. Okay, that was it. Does anyone have any questions?
Well, thank you so much for that amazing presentation. I apologize that you weren't able to share some of those videos. If you'd like to send your PowerPoint slides to MDA so that we're able to share that with the community, that would be great. I'm just going to open up the Q&A and just wait a moment or two for any questions that come into the chat box. All right, so it's looking like we don't have any questions at the moment, but this will be recorded and posted on mda.org. So if you do have any questions about this particular presentation, you can email mdaengage@mdausa.org. I want to thank you again, Kim and Jennifer, for presenting on everyday tips for exercise, adaptive clothing, and self-care. We really appreciate all you do for MDA and for the neuromuscular community. So thank you again for your presentation today.
Thank you so much.